Good morning to the viewers of live cases, complexcases.org. Today's case was very special in the sense that first time we showed performance of PCI after core valve implantation. So, this patient had a core valve few years ago and came back, has a residual coronary disease. He did have a bypass in the past, but has a left main and circumflex lesion, and we showed various steps how to engage these catheters, the guide catheter, and perform the complex PCI through the struts of the core valve. So, everything came out very good, and patient had a stent after rotation atherectomy, did use a guide liner, and has an indirect blood flow from diagonal to OM, although circ ostium is closed. But it was very useful from the technical point of view, because we will be seeing more and more these emerging cases which have received the tower and now come back with the CAD, not necessarily the valve related issues, but for the coronary artery disease. As far as the didactic discussion, I discussed 2 points. One is the MACE trial, which was the prospective randomized study of the various degree of calcification and 1 year outcome, which showed that severely calcific lesions have a bad outcome compared to mild or moderately calcified lesions. Second was the absorb 3 data, which 2-year data, which was presented in ACC and led to the FDA alert that do not use the absorb in the small vessels, and we emphasize that this device is good for limited use in the large vessels, but definitely small vessels should not be used. And from my recommendation is that even 2.5 millimeter absorb BVS should not be made. But overall, it was a very